Hello and welcome to yet another episode of Doctors In. Today we have with us Dr. Levente, who is an ENT consultant specialized in nasal surgery, including rhinoplasty. Welcome, doctor.
Good morning.
First of all, we would like to know more in detail about you.
I'm an ENT surgeon who has an interest in nasal surgeries, including sinus surgeries and also the rhinoplasty.
Okay.
You can ask why, how can you link these two together? The answer is quite simple, okay? Form cannot be without proper function. When I was a junior doctor, I saw so many times patient coming back after rhinoplasty saying then, doctor, I cannot breathe. My nose looks beautiful, but I cannot breathe. And when I look inside, I saw obviously there was a problem with the septum, or they have corrected outside the nose, and by time being several years later on, the nose started to get curving, collapsing.
Okay.
So if in the market you see there is a big shift regarding nasal surgeries. The nasal surgeries is performed by the ENT surgeon, but you need to upgrade your knowledge with a rhinoplasty. So therefore the successful rate is much higher, and actually you can deliver the function and the aesthetical appearance in the same times, because you never get a happy patient without proper function. You can have a beautiful nose, but if it's not functioning, you don't need.
Yeah. Why you have interest in nasal surgery?
Why is it that important? Why do you have a lot of number surgeries here? The reason is because here, mostly in this region, functional problems, nasal blockage is extremely common because we barely breathe outside. In the air, we go to the mall, we turn on the AC in the car, and even if we go outside, we go to the desert, we have sand there. And chemicals, all these causing constant inflammation inside your nose, and the constant inflammation is causing blockage and chronic sinus problems.
Okay.
So this is the aesthetical, this is the functional part. So we are performing a lot of sinus surgeries, septum surgeries, which is the middle wall of the nose, turbinate reduction, and the good and the really unique in this service here is we are combining the functional surgeries with aesthetical. So if you said, doctor, my nose is blocked for a long time, can you help me with that? By the way, if I sleep, can I just do this little bit? And we are not saying then you need to see some other doctor. You come and in the same moment, with one surgeon, both of them can be assisted.
Is rhinoplastic surgery just for teenagers?
I mean, it was used to as a unique, then just only teenagers or just a special person get it. And we just actually reviewed our last year case series, more than 250 rhinoplasty done. And I have to tell you that we had more than a half was a male rhinoplasty. So we see more and more men coming because they have the rights also to have a beautiful nose, right? They actually have a right expectation. And there is different ages approaching us, not just the young, because we believe the rhinoplasty is coming, then they want to get the hump done a little bit and that's it. No. Even when we're getting older, the nose shape is changing. You can see a little bit the cartilage, the tip is going down a little bit, and they're asking then, doctor, can you refresh my nose a little bit? And this is called the nose refreshing, anti-aging, when you're just lifting up a little bit. It's extremely straightforward procedure, and it's really good with the success rates.
Is there anything new in the field of rhinoplasty?
The new meaning that we are learning from our mistakes. Rhinoplasty started in 1980s back in the States, and since then they keep doing it. And you can see by the long term, like 10, 15 years, how the rhinoplasty had been changed. we're doing much less traumatic approach, and we're using this constant tissue cooling technique. So on the same day the patient goes home, the bruises are much less than it was before. So most of the patient big fear is after the surgery they get a wrinkle under the eye and bruises. They have severe pain, and it had been changed. It had been changed. Basically most of the patient going home on the same day, 2 days, 3 days time they come back, and cast gone after 5 days, and majority of the patients 7 days they go back to work without noticing, and they looked like they had a car accident. So basically the major changes what we have, we are much more polite to the nose than before, a much more precise instrumentation, and the surgeon skills, I do believe that's the key. The key is the surgeon hand.
Okay. So what is your secret in achieving high satisfaction in your practice?
Spending time with the patient, spending time who want to get the surgery, because I need to understand what do you wish. Because we usually say the rhinoplasty only is successful if it's needs, if it's met with your needs. Because if you are not happy, then even I can do the best, then it would never work. It's like if you put the most beautiful female nose on the man, right? It would never match. So what we can see in Dubai, there are two major types of rhinoplasty we perform. One is, which I much more prefer, is, doctor, I would like to get a little bit this, a little bit that, can I have this one? But basically I would like to carry on my life like it is. Another type of rhinoplasty is, doctor, make me that nose, then everybody can see that I had the rhinoplasty and it exactly looks like this famous actor. Okay, and they come with the pictures showing, doctor, I would love to see this nose on me. These are the most challenging and most, I would say then this is, you need to be careful. And if the patient coming with this, we usually have several times meeting. So we meet first, you try to explain what do you see, I tell you what is possible, okay? We making a photo shooting, we printing out, we explain to you how does it, we are thinking, and we send you back, send home. Usually the lady is spending a lot of time in the bathroom at night to see if I do this, if I do, what the doctor said, oh yes, yeah, let's talk about it, okay? So when the second time when you come back to my clinic, you are more expert in the rhinoplasty field, and I have usually this question, tell me 3 things you wish to change on your nose. What is must to be done, which is need to be done, and if you could. So I go through this, and when we finish the second, sometimes 3 or 4th consultation needed, then we write down what I'm going to go in. You and me, we go to the OT. I have your wish list on the wall, and we're finishing the surgery when all the list had been gone.
Okay. So doctor, that was nice talking to you. Thanks a lot for being a part of the program. So that was Dr. Levente with us. Until we meet next time, this is me, Nana, signing off. Take care.